Hello again, guys. I'm Chris Galucci, and today I chose my Power of 3 Module 11 presentation on Native Hawaiians and Pacific Islanders. Let's begin with a little history. The Pacific Islands, also sometimes called Oceania, consist of 3 distinct island groups in the Pacific Ocean, namely Micronesia, Melanesia, and Polynesia. These groupings are useful in that they cluster people by common heritage and to some extent by cultural practices and values. The islands are widely dispersed over vast regions, which can make the provision of healthcare in regions a daunting challenge. Thousands of years ago, the Pacific Islands were populated progressively from west to east by several migrations of fishermen from Malaysia and Southeast Asia. People were organized in tribes or clans and generally shared the Asian attitude of the importance of the group over the importance of the individual. Prior to Western contact with Captain Cook in 1776, like this image shows here, it is estimated that there were 300,000 to 400,000 native Hawaiians, although some have estimated that number to be much greater. However, in Hawaii as in other isolated areas, contact with Western diseases for which a native population had no immunity, measles, chickenpox, and venereal diseases as an example, it nearly extinguished the native population. Many health disparities suffered by native Hawaiians today are thought to have their origin in what is referred to as cultural historical trauma, which is the psychological, physical, social, and cultural aftermath of colonialism. This includes the loss of social structures, lands, and ways of life, as well as the effects of racism and discrimination. The term also refers to the cumulative emotional and psychological wounding that seems to be carried forth into successive generations and affects all aspects of health. This cultural wounding can result in communal feelings of disruption and a sense of collective helplessness, which in turn can impact one's sense of self and health-seeking behaviors. Gabriel Reilich's video demonstrated that if the world had only 100 people, that there would be 14 Americans, 11 Europeans, 15 Africans, and 60 Asians. Pacific Islanders and Native Hawaiians would be a part of a group called Oceania, but the numbers are so small that it would be not able to be represented on this infographic. However, for purposes of this presentation, we will look at those belonging to the United States only. If we were to scale down the U.S. to only 100 people, the Native Hawaiians and Pacific Islanders would only make up about half a person, at roughly 1.2 million. Most notable in Hawaii and the western states, California, Washington, and Oregon, is where you will find a majority of this population. The data on Native Hawaiians and Pacific Islanders is often limited and confounded by the aggregation of races with different patterns of health risk under headings such as Asians and Pacific Islanders. This is problematic since it does not recognize the diversity that exists within this population group. For example, average life expectancy for Asians and Pacific Islanders is 80.3 years, which is higher than the life expectancy for the total U.S. general population. However, Asians and Pacific Islanders include both the Japanese, who have one of the longest life expectancies at 82.1 years, as well as Native Hawaiians, who have one of the lowest at 68.3 years. In general, Native Hawaiians and Pacific Islanders are known to bear disproportionately higher prevalence of many common conditions such as obesity, diabetes, with cardiovascular disease being the #1 cause of death. In addition, key health indicators such as life expectancy continue to document disparities that exist between Pacific Islanders and the general U.S. population. 32% of Native Hawaiian older adults self-reported being in excellent or very good health, compared with 49% of Caucasian older adults, with similar percentages of Native Hawaiians and Caucasians reporting either fair or poor health. In regards to receiving preventative health care, Native Hawaiian older adults were similar to their Caucasian counterparts in terms of receiving annual flu shots and in having health care coverage. In other areas of preventative care, studies have found that Asian and Pacific Islanders have lower rates of pneumonia vaccination, underuse of mental health and preventative services such as cancer screening, and poorer early detection rates compared to other ethnic groups. A study on health-seeking behaviors of Native Hawaiian men found that primary reasons for postponing a visit to the doctor included not wanting to know, embarrassment, shame, fear, or not having enough time. Given the higher prevalence of many common conditions such as obesity, diabetes, and cardiovascular disease, studies in Hawaii and other islands have suggested that a return to the traditional diets could help lower serum cholesterol, blood sugar levels, as well as other obesity-related conditions. Specifically, Native Hawaiians have the highest incidence of morbidity and mortality and the highest age-adjusted mortality of any ethnic group in Hawaii. As an example of how Westernization has affected the lifestyle of many Native Hawaiians, Consider how the traditional diet, which was low in fat and high in complex carbohydrates, has changed to a typically Western diet high in fat and low in complex carbohydrates. Currently, the prevalence of obesity in native Hawaiians is 69.3%. Micronesia offers another insight into the effects of dietary change. Instead of fishing and agriculture, many Micronesians have come to rely on canned meat, shortening, and salty canned fish that is readily available as a result of Micronesia's past true relationship with the U.S. Consequently, rates of cardiovascular disease, obesity, and diabetes are also increasing. These increases in diet-related diseases highlight the effects of Westernization on these special populations and give insight into possible reasons that may be contributing to the large uneven proportion of health disparities. Asians and Pacific Islanders are known to underutilize mental health services. Consistent with these low utilization rates, Native Hawaiian older adults have a relatively low suicide rate of only 35 per 100,000, which is approximately half of the overall rate of the entire state of Hawaii. However, dementia disproportionately affects some Pacific Islanders and is reportedly twofold higher compared to Caucasians. Smoking prevalence is high among Native Hawaiians and particularly among other Pacific Islander populations. For example, the prevalence of smoking among Samoan men is reportedly greater than 50%. Among Native Hawaiian older adults compared to Caucasian older adults, Native Hawaiian older adults reported smoking every day or some days. By contrast, Native Hawaiian older adults were at an overall lower risk for binge drinking or heavy drinking than Caucasian older adults. Methamphetamine use is reportedly higher among Native Hawaiians living in Hawaii. And now we'll talk about infectious diseases in the special population group. Leprosy is one of the unique infectious agents that may be seen among Native Hawaiians and other Pacific Islanders. Beginning in about 1996, chemoprophylaxis was introduced as part of a leprosy control program, which identified a decreasing number of new cases in each successive round of screening. Hansen's disease and hepatitis B infection are relatively common infectious diseases that affect Native Hawaiians and other Pacific Islanders. A 2007 study concluded that hepatitis B viral infections are strongly associated with diabetes among Asian Americans, but not among Pacific Islanders. Among Native Hawaiian and Pacific Islander adult populations, the risk for these infectious agents are unclear, but early screening to detect these infectious agents might be warranted for early treatment and prevention efforts. There are numerous cultural values that are important to Native Hawaiians. The ones I'm going to talk about here were selected specifically since they are often relevant or helpful in a healthcare setting to better help clinicians or healthcare providers understand the special population in hopes of providing better care. Central to Native Hawaiian understanding of health is this concept of lokahi, which means balance or harmony. This is sometimes referred to as the lokahi triangle, which means that health is holistic. One is healthy when the physical, mental, and spiritual parts of a person are all in harmony. The 3 points of the triangle not only include the physical body, but also the environment surrounding that person, relationships to others, particularly family members, ancestors and gods, as well as mental and emotional states. Ohana, which means family, is another important concept that is important to Native Hawaiians since extended family is their primary social structure, with many still living in multi-generational homes. Illness affects the entire family, and therefore family members need to be involved in the decision-making process and treatment plans. Aloha has many meanings, but the majority of it centers around the concepts of love, caring, and compassion. Native Hawaiians need to feel that they are being respected and cared for if they're to be willing partners in the patient-physician relationship, entailing the establishment of trust. So given all the information we talked about, how do we approach healthcare with this group? Just as a little side note, Native Hawaiians and Pacific Islanders are a very diverse group, so it is important to avoid stereotyping. Understanding the individual will give a better insight into the approach of care. Now, establishing a relationship based on mutual understanding and trust will help to increase compliance with treatment. Taking the time to answer questions, educate, and explain. Involvement of the ohana, or family, is important to ensuring success. Compliance may be adversely affected by healthcare access and limitations of insurance coverage. Many patients live in rural communities and/or rural neighborhood islands and may not have access to primary care clinicians, specialists, and hospitals. Native Hawaiians have one of the poorest socioeconomic conditions in the state. Barriers to care such as insurance status, ability to pay, homelessness, transportation, childcare, and school and work responsibilities must be considered when planning medical tests and treatment interventions. This is particularly important if the patient is dependent upon family members for transportation, housing, and food. Costs for medications are sometimes weighed against other family expenses such as food, rent, utility, and bills. Noncompliance may also be a consequence of abandoning medical treatment in favor of traditional remedies, especially if the patient's condition does not improve immediately with conventional medical treatments. This may be a result of distrust in Western medicine, and it therefore is important to ask questions. The Hawaiian people should be able to nurture their culture and have an active role in planning their plan of treatment and prevention programs. Healthcare professionals, public health planners, and health educators need to learn more about Hawaiian culture and healing practices in order to become culturally competent. Preserving the cultural heritage of clients improves the integrity of the profession and the methods. By learning more about a culture based solely on the love of life and harmony with nature, we can do more to help ourselves. By sharing the philosophy and practices with others, we can help them lead healthier lives. Discussion questions. Central to the health beliefs of Native Hawaiians is the concept of lokahi, meaning balance, which focuses on the idea that an individual is only healthy when the physical, mental, and spiritual parts of the person are all in harmony. Number 1. In regards to the patient care, why is employing a holistic approach important, and what are the implications it may have in regards to dealing with these special populations? Number 2. What are some of the ways in which Westernization has contributed to greater health disparities in certain ethnic groups and special populations? Give some examples. Number 3. What is the difference between Westernization and cultural historical trauma? Provide examples.